Hello everyone, and thank you for joining me today. My presentation will focus on the opioid crisis and the critical role of social work in addressing this pervasive issue. My name is Dylan Beresford. I'm a social work student at Metro State University in Denver. I also work as a substance use disorder counselor, where I have firsthand experience in supporting individuals in their recovery journeys. This presentation aims to shed light on the opioid crisis, its impact on our communities, and how we as social workers can contribute to meaningful change. The opioid crisis refers to the rapid increase in the use of prescription and non-prescription opioid drugs in the United States. It includes the misuse of prescription pain relievers, heroin, and synthetic opioids like fentanyl. Who it impacts and why it's an issue. The opioid crisis impacts individuals of all ages, genders, and socioeconomic backgrounds, particularly those with chronic mental health issues or a history of substance use. Families experience emotional, financial, and social strain when a member suffers from opioid addiction. Communities face increased healthcare costs, higher crime rates, and a greater burden on public health and social services. On a broader scale, society is affected by the widespread impact on public health, economic productivity, and social stability. Why is it a social justice issue? Health disparities are a major concern, with unequal access to treatment and recovery resources, especially in marginalized communities. People with opioid use disorder often face significant stigma and discrimination, preventing them from seeking help. This crisis also exacerbates economic inequality, hitting low-income communities the hardest. To address these issues, there's a crucial need for policy focused on prevention, treatment, and recovery, along with strong advocacy to support affected individuals and their families. The opioid crisis has led to a significant increase in overdose deaths in recent years. According to the CDC, provisional data indicates that drug overdose deaths reached an unprecedented high in 2021 with nearly 92,000 fatalities reported. This surge is largely attributed to the widespread availability and misuse of synthetic opioids such as fentanyl, which are significantly more dangerous than others. The increase in overdose deaths highlights the urgent need for comprehensive public health strategies, including prevention, treatment, and recovery support services to combat this escalating crisis and save lives. Social workers play vital roles in addressing the opioid crisis at various practice levels. At the micro level, social workers provide individual counseling and support by creating personalized treatment plans, offering emotional support, and connecting with clients and necessary resources. At the meso level, social workers facilitate group therapy sessions and community-based recovery programs. These programs create a supportive environment where individuals can share experiences, learn from each other, and build a sense of community, which is essential for sustained recovery. At the macro level, social workers advocate for policy changes and systemic reforms. This includes pushing for better access to treatment, reducing stigma, and working towards comprehensive public health strategies. Guided by core values, social work practice emphasizes the dignity and worth of every person and the importance of human relationships. By operating at these levels and adhering to these values, social workers can significantly impact the fight against the opioid crisis. Let's discuss the need for policy change around criminalization of drug use, which significantly drives the overdose crisis. In 2022, there were 107,941 overdose deaths in the U.S., which is an increase from the previous year. Overdose deaths have risen in most states and Washington, D.C. The unregulated and unpredictable drug supply resulting from drug crackdowns and enforcement is a significant factor in this crisis. Since 2013, fentanyl has driven major increases in overdose deaths. Fentanyl entered the market following crackdowns on prescription opioids and heroin, intensifying the opioid crisis. This phenomenon, where harsh enforcement leads to the emergence of more potent drugs, is known as the law of prohibition. Criminalization exacerbates the overdose crisis by increasing deaths and worsening the overall situation. Overdose deaths in jails and prisons have more than doubled, with individuals being 27 times more likely to die from an overdose within 2 weeks of their release. Fear of arrest deters people from seeking help during overdoses too, which leads to preventable deaths. Despite harsh penalties for fentanyl-related substances since 2018, overdose deaths have continued to rise. In 2022, all states except Oregon criminalized low-level drug possession and sales, yet overdose rates have not decreased, demonstrating the ineffectiveness of criminalization. To combat the overdose crisis, we must shift from criminalization to policies that promote harm reduction, regulation, and support for those affected by substance use disorder and their families. To fully understand the opioid crisis, it's important to look at both its historical roots and present-day concerns. The opioid crisis remains a severe public health issue, with nearly 92,000 overdose deaths in 2022, primarily due to fentanyl. These potent drugs make the drug supply more dangerous and unpredictable. Many individuals still lack access to effective treatment and recovery resources, and stigma prevents many from seeking help. Economic and social inequalities further exacerbate the crisis, especially in marginalized communities. Addressing these concerns requires comprehensive public health strategies, increased access to treatment, and harm reduction approaches to support those affected. Here's a timeline of the opioid epidemic. Opioid addiction has a long history, starting with the widespread use of opium in the 19th century. In the late 1990s, pharmaceutical companies aggressively marketed prescription opioids, falsely claiming they were non-addictive, which led to widespread misuse. By the early 2000s, heroin use surged as a cheaper alternative when prescription opioids became harder to obtain. The crisis intensified in the 2010s with the introduction of synthetic opioids like fentanyl, which significantly increased the overdose deaths. Addressing the future actions needed to combat the opioid crisis requires actionable steps for both students and social workers. Information for fellow students. Understanding the full scope and impact of the opioid crisis is crucial. Recognizing its widespread effect on families, individuals, communities, and reducing stigma around addiction by encouraging compassion and support is vital. Action for students. Students can get involved in local advocacy and support groups and educate peers about the dangers of opioid misuse. Offering support can significantly change perceptions and behaviors. For social workers should advocate for comprehensive public health policies addressing prevention, treatment, and recovery. Implementing community-based programs provides much-needed support and resources at a local level. Personal plan. I plan to continue my education in social work with a focus on substance use disorder treatment. Engaging in internships and volunteer opportunities will help me gain practical experience. I will also advocate for policy changes and develop community resources to support recovery efforts. Resources for further information and action. For more info or to get involved, I recommend the Substance Abuse and Mental Health Services Administration and Faces and Voices of Recovery. These organizations offer valuable resources for advocacy and support in fighting the opioid crisis. The links are down below. By taking these actions and utilizing these resources, we can significantly reduce the impact of the opioid crisis. In conclusion, the opioid crisis is a significant social justice issue impacting millions. We've explored the historical context, present-day challenges, and the critical role social workers play at micro, meso, and macro levels. Social workers are uniquely positioned to advocate for policy change, provide direct support, and foster community resilience. Moving forward, we must continue advocating for policies that address the root causes of the crisis and ensure equitable access to treatment and recovery resources. By staying engaged and proactive, we can contribute to lasting change in our communities. Thanks so much for your time. I hope this presentation has provided valuable insights and inspired you to take action. Feel free to reach out to me with any questions or thoughts you might have. Thanks again.